Hello, I'm Torsten Bove, and I will be presenting a poster with my colleague Thomas Zavada. We both work at TOOsonix in Denmark. Our poster will give the background for transducer modeling and transducer design, and we will illustrate how that can be used to a new field for HIFU, which is medical dermatology, and how we can treat a very wide range of diseases of the human skin. In focused ultrasound, our overall intent is of course to concentrate high acoustic energy in a focal zone inside the body. And there are several ways to calculate this focal zone size and the conditions around it. If we start with the simplest method, we can calculate the focal zone as a simplified and isolated ellipsoidal shape. This gives us the first idea of the sizes we generate by the transducers and how the frequency will directly influence the clinical effects. If we need to look at side lobes and specific geometrical features of our design, we can use the full model from Lucas Viewer. And finally, we can extend the calculations to complex KZK models where we calculate the full spatial data, including more materials and nonlinear effects, as shown here in these two examples. As with any model, we always need to fit and optimize them to the real-world results. And here we use simple comparisons between our calculated results with the visual observations in a phantom gel. For more qualitative measurements, we use hydrophone scanning, as shown here, or we use the direct visible sclerin imaging to optimize our models. And then once we have a validated model in place, we can start working on real optimization and guidance. As shown here, we can, for example, build models that calculate the expansion of a thermal zone around the focal point over time in a real tissue. This is something that we know is really useful in developing guidelines for the best possible clinical response in actual treatments. So, having said all of this, all models at all measurements confirm a very simple and intuitively logical conclusion, and that is that the higher the frequency, the lower the focal zone size, and vice versa. The frequency, however, also directly affects parameters such as attenuation and thereby how deep one can treat, but thereby also how big the risk of damaging neighboring healthy tissue that was not meant to be treated is. Making the final design of a transducer is therefore always a balancing act with several parameters that are unfortunately interconnected. And we're not alone in looking at this balancing act. The general relations and compromises are clearly seen in the HIFU devices of today. The Insightec exablade systems targets the center of the brain and goes to the skull. They therefore operate around 650 kilohertz. The profound Sonaleaf systems treat large internal tumors. They operate around 1 megahertz. Theraclean EcoPulse treats relatively superficial breast and thyroid tumors. They operate at 3 megahertz. And devices such as the Ulthera Deep Sea or Softwave makes lesions in the subcutaneous tissue, and they operate around 4 to 12 megahertz. Based on these considerations and calculations, our poster will demonstrate a device for dermatological therapy that works at 20 megahertz. The device is optimized for targets that are even smaller and located just in the very thin dermis and epidermis layers of the human skin. And since the targets are located at this very shallow depth, the system can utilize optical guidance instead of ultrasound or MR guidance and have direct visibility of the treatment as we treat in real time. And on the poster, we will show some very good results of treatment of basal cell carcinoma, the most common cancer in the world, cutaneous neophroblastomas, which is a very common genetic disorder, actinic keratosis, which is a precancer condition, also extremely common, and a range of more benign conditions that are nevertheless in need of good clinical options, and that includes congenital hemangiomas, seborrheic keratosis, and sebaceous hyperplasia. I hope this short presentation will tempt you to come and hear more about HIFU for dermatology. As we already know, the treatments are fast, they are non-invasive, they are pharma-free, and they are radiation-free. And the patient outcome is very positive, very quick healing after treatment. So in TOOsonix, we believe that HIFU for dermatology is going to be a very strong addition to the already existing treatments of the deeper organs. So we would very much love to discuss that further, and we hope to see you at the ISTU Lyon 2023. See you there. Thank you.